So hi, my name is Alyssa Reeves. I'm in section 4. I'm doing an NG tube. I'm gonna verify the doctor's orders. We have an NG tube, French Levine, single lumen, size 12, 18 inches, and we're gonna put it on intermittent suction, low intermittent suction for some nausea and vomiting for our patient. So now I'm gonna take all my supplies into the patient's room. Knock, knock, knock. Make sure you do my hand hygiene as I'm coming in, and make sure the bed is in high Fowlers and it's raised. I'm going to do my 2 identifiers. Can you tell me your name and date of birth? Okay, great. And then, so today we're going to put you on an NG tube because you've got some severe nausea, vomiting. We're going to put you on some decompression so that way we can relieve some of that. Now I'm going to assess the NIRS. All right, second. All right, blow in. All right, and okay. So it looks like, can you tell me if you've had any surgery on your nose or a deviated septum? No? Okay, so I'm going to go ahead and go in through your right ear. The next thing I'm going to do is measure the tube from the nose across the ear down to the xiphoid process. And I've got it right here, and I'm going to go ahead and mark it with a Sharpie so I know where to stop my tube. I'm going to put a towel over your chest. We're going to place the tube here as I wash my hands and put on my gloves. Okay, so first, before we start, I'm going to put it in the water and put it in the lubrication. I just need you to tilt your head back for me. I'm going to put in the tube into your nose now, so it might feel a little uncomfortable. Okay, so once it's in the back of the throat, I'm going to check for any coiling. There's no coiling, so I'm going to have you sip on this water as I advance it further, and I want you to put your head forward for me. So right there. Okay, sip, sip, sip. Very good. Okay, so real quick, I'm going to just tape the tube to your cheek, and now we're going to verify placement. So can you speak for me? Okay, great. You can speak clearly. And I'm going to check again for coiling. We have no coiling in the back of the throat. Now I'm going to aspirate the gastric contents. I'm going to aspirate 30 milliliters. I'm going to note that it's cloudy and green. We're going to check pH. Oh, check pH. Okay, pH is 3.0. Very good. And now we're going to listen for the gurgles as I aspirate, or I put the fluid back into your stomach. Okay, very good. I hear gurgles. Okay, so now that we've got a better idea of where that the tube is in your stomach, I'm going to go ahead and anchor it down. We're going to anchor it. Going to use a rubber band to tape it to the, or to attach it to the gown. It's not taped. Using a slip knot so it's loose. Okay, and now we're going to hook you up to some suction. Okay. So now I'm going to lower the bed and make sure the patient is comfortable, his call light's within reach, all his personal belongings are where he can get them. Are you in any, how was the procedure? Are you in any pain right now? Okay, good. And then, I don't remember if I said to go to the restroom, so I'm going to ask him again. He has to go to the restroom. And then I'm going to the doctors are going to come back and take you for a chest x-ray. I'm going to come back and when we do a after the chest x-ray and irrigate your tube. Oh, and after I leave the doctor's room, I'm going to document the type of tube, the length, the size, what it was used for, the time, the consistency and color of the secretions, and any instructions I've given, and how the patient tolerated the procedure, and then the pH and the amount of aspirin. So it looks like we have 200 cc's. So 40 minutes later, can you see me on the screen?
Yes.
Knock, knock, knock. Coming into the patient's room, we've had a chest x-ray. We verified that it's in the correct place. I'm going to do my hand hygiene. Going to check my verifiers again. I'm going to check my verifiers again and my placements. So first I'm going to check for any coiling in the back of the throat again. No coiling. We're going to pretend like this didn't fall on the floor. And can you speak for me? Okay, you can speak. All right, we're going to take you off suction and we're going to aspirate again. We're going to aspirate 30 milliliters. Check the pH. Okay, the pH is 3.1. It's still good. We're going to listen for the gurgles again. Okay, gurgles were heard. Now we are going to, I gotta put a towel back on you. And put that here. I'm going to aspirate 30 milliliters of saline. I'm going to irrigate the tube. Before I do that, actually, I'm going to do my hand hygiene and put on my gloves before I do any of the other things too. And then we are going to insert the 30 milliliters, aspirate 30 milliliters. We're going to aspirate what we took, discard it, and hook them back up to suction. I'm going to do my P's again. Are you in any pain right now? Are all your personal belongings where you can get them? Is your call lights in reach? And do you have to go to the restroom? Okay, good. I'm going to lower the bed, make sure that your head stays at a 30 degree angle, and I'm going to go document again. And this time I'm going to document the type of irrigation, which was normal saline. I'm going to document the difference withdrawn than that was taken. We took the same amount that we withdrew, and I had no difficulty irrigating. The patient tolerated with no discomfort, and the solution was a cloudy green. Okay, thank you.